Are there risks associated with taking either melatonin or glycine for kids or adults for sleep? So for glycine, and this is a supplement I just talked about on a couple other videos, no, it's actually one of the safest ones out there. And the dosages that we use for sleep are like really small, like 500 milligrams to like maybe 3,000 milligrams in kids. And it's used up to like 60,000 milligrams for schizophrenia. And like nothing has been found at those higher doses. So like the lower doses, not worried. But hypothetically, if you have like chronic kidney disease or maybe like diabetes or something like that, maybe there could be some additional risks, and that would be something to talk to your provider about. But like for a typical kid, no. I would say also ask your provider if you're doing ketamine right now or memantine. Those would be like the two meds that also affect the same receptors. Melatonin, you can develop tolerance, and there is like concerns around if you take it too long, then it can affect your actual production of melatonin. So it's recommended every few months to taper off for a couple weeks, give it a break, and then go back to it if you're going to use that. And the thing to remember about melatonin is like, yes, it's a supplement, but it's also a hormone, and hormones have systemic effects on our bodies, right? So it's unknown right now if it can affect like puberty in kids. There's a lot more research to be done. And then in some animal studies, it's shown that that can affect fertility. But again, like sometimes for animals, when they do studies on these, they're giving like extremely like wildly high dosages. So it's not what we would see in like a typical human body taking a supplement over the counter. But that's like very long-term use, and it's, again, like it's not proven.